When was the last time you felt completely alive in your own body? If you're over 60 and intimacy, especially your ability to enjoy self-pleasure, feels diminished, I want you to know something up front. This is not simply the way it has to be. Hi, I'm Dr. Julia Morgan, board-certified urologist. In my clinic, I see men in their 60s and 70s who feel disconnected from their bodies, embarrassed to talk about it, and convinced the only options are pills or resignation. The truth I want to share in plain terms is this: it's not just age, it's biology, and it's what you feed and how you care for that biology. Today, I'm going to walk you through practical, safe steps centered on the title you came for: How to Masturbate Safely After 60, the 3 mistakes you must avoid. If this is hitting home, type your city and age, or just one in the comments so I know you're here. Let's start with the basics, the engine behind sexual response and sensation. Think of the genitals as a hydraulic system that needs 3 things working together: good circulation, healthy hormonal and mineral support, and intact nerve health. Circulation is controlled by a system of blood vessels and by something called nitric oxide. I like to call it the green light for blood flow. When nitric oxide is produced, it tells the blood vessels to relax and open. When it's low, or the vessel lining, the endothelium, the green light gets dim. Hormones and minerals like zinc and magnesium are the building blocks that support energy, desire, and testosterone balance. Not a magic bullet, but essential bricks in the wall. Finally, nerves are the telephone wires that carry sensation. Their membranes need healthy fats, especially omega-3s, to function well. If any one of these is impaired, lower blood flow, missing minerals, or damaged nerve membranes, the experience of self-pleasure can feel blunted, slow, or uncomfortable. Now, before we get into the 3 mistakes, one more framing point. Small, consistent changes can move the needle. We're not promising miracles or guaranteed restoration of youth, and we're not replacing medical care. We are talking about evidence-informed, practical steps that many men report help with response and comfort. With that, here are the 3 mistakes I see most often, and how each directly affects safety and pleasure. Mistake number 1: ignoring circulation. This looks like a daily pattern of processed, inflammatory foods, low activity, and skipping foods that support nitric oxide production. Why does this matter? Poor circulation means less blood to the tissues when you need it. Less blood flow leads to weaker or slower engorgement and a duller sensation. It also increases the risk of tissue irritation when you use forceful or repetitive motions. Men will often say, "It just takes too long now," and they compensate by poking or pressing harder. That's not helpful. It adds friction and stress to tissues that aren't getting good oxygenation. What to do instead? Think green light foods and timing. Dietary nitrates found in beetroot and watermelon can support nitric oxide pathways. Many men find a small serving of beet juice or a beet-based smoothie about 60 minutes before self-stimulation can make a difference in blood flow for that session. Dark chocolate, high in flavonoids, can also support endothelial function over time. The approach is not to gulp a bottle and expect overnight results, but to incorporate these options strategically. For example, one practical pre-activity choice is 8 to 12 ounces of beet or watermelon juice about an hour before. If you have heart disease or you take prescription nitrates or medications that interact with blood pressure, talk to your cardiologist before trying this approach. Safety first. Mistake number 2: neglecting hormonal building blocks and minerals. Zinc and magnesium aren't glamorous, but they matter. Zinc plays a role in testosterone production and cellular repair. Magnesium helps with relaxation, sleep, and stress regulation, all of which affect sexual function. A lot of men assume their hormones are out of control because of age and reach straight for pills or quick fixes, but often they simply lack steady nutritional input of these minerals. Over time, that creates lower baseline energy, reduced libido, and less responsiveness. Practical fixes: Add zinc-rich foods like oysters when possible, or pumpkin and squash seeds several times a week. Aim for magnesium-supporting foods such as leafy greens, nuts, and seeds. Whole grains and legumes help too. Dark chocolate again can offer small benefits when eaten in moderation. These are not immediate hacks, but steady supports. One of my patients, Harold, 61, found modest improvements in his morning erections and energy after making these tweaks consistently for a few weeks. He didn't stop his prescribed medications, and he checked with his physician before starting supplements. That's the model: steady building blocks plus medical oversight. Mistake number 3, forgetting nerve health and safety. Nerves don't like chronic low blood flow, and they certainly don't like repetitive high-pressure trauma. Low omega-3 intake makes nerve membranes less flexible, reducing sensation and slowing conduction. But an equally important piece is mechanical safety. Rough technique, excessive force, or ignoring pain can cause numbness, persistent irritation, or even nerve injury over time. I see men who keep pushing through tingling or numbness and later develop longer spells of reduced sensation. The fix is twofold: nourish nerves and change technique for safety. Nutrition first. Include omega-3 rich foods like wild oily fish, salmon, mackerel, walnuts, and ground flax or chia. Even a handful of walnuts daily or a portion of fatty fish a few times per week can be helpful for membrane health. Technique. Emphasize gentle, well-lubricated motions and attention to sensation rather than speed or pressure. Use a good quality water-based or silicone-based lubricant to reduce friction and prevent skin breakdown. If you experience any sharp pain, persistent numbness, or bleeding, stop and see a clinician. These are red flags. Victor, 64, shared with me that simply switching to a generous application of lubricant and slowing down reduced the numb, dead feeling he had developed in just a few sessions. Those are the 3 mistakes in a nutshell. Now let's convert that into a practical routine you can try safely, a pre-activity plan, and a 30-day reboot that's realistic for busy lives. First, the pre-activity checklist. Things to do in the 60 to 90 minutes before you plan to be intimate with yourself. Hydrate. Even mild dehydration can make tissues feel tight and less comfortable. A glass of water 30 to 60 minutes before helps circulation and reduces cramping. Choose a light, nitrate-rich option if appropriate. About 60 minutes before, consider a small glass of beet or watermelon juice or a beet smoothie. If you have cardiac disease or take prescription nitrates, speak to your cardiologist first. Avoid a heavy meal immediately before self-pleasure. A heavy, fatty meal diverts blood to digestion and can make you feel sluggish. A light snack paired with the nitrate options is ideal. Apply lubricant. Don't be shy with it. Lubrication prevents friction and tissue trauma. It's one of the simplest safety measures. Warm up. A short period of gentle stimulation, focusing on relaxation and breath, helps blood flow increase gradually. Think of it as warming up before exercise. Start slow. Next, a practical 7-14-30-day plan to reintroduce nutrition and track progress. This is not a rigid diet plan. It's a stepwise approach so you can see what helps you personally. Week 1, days 1 to 7, foundational changes. Add 2 servings of omega-3 foods during the week, for example, a portion of wild fish or several servings of walnuts. Begin a daily small serving of pomegranate juice or a handful of berries for antioxidants. Check your medications and make an appointment with your primary care doctor or cardiologist if you're taking nitrates, have unstable chest pain, or recent cardiac events. Week 2, days 8 to 14, layer in minerals and timing. Add a zinc-rich snack 2 to 3 times this week: pumpkin seeds, a small serving of oysters if available, or a mixed seed pack. Start trying a beet or watermelon juice about 60 minutes before planned self-stimulation on 2 separate occasions this week to see if you notice a difference in timing or firmness. Record any subjective changes: faster response, more warmth, or increased sensation. Keep hydration steady and sleep a little earlier if possible. Sleep supports hormone and nerve recovery. Weeks 3 to 4, days 15 to 30, consolidate and observe. Make the beet or watermelon pre-activity approach a regular option and keep dark chocolate and nuts as daily or frequent snacks. Track morning erections, baseline energy, and the quality of sensation during self-stimulation. Use a simple diary. Date, what you ate that day, any supplements, how long it took to achieve a response, and how the sensation felt on a 1-10 scale. If you try more vigorous or new techniques, pair them with extra lubrication and take more breaks to prevent overuse. Across the 30 days, you're not aiming for perfection, you're looking for patterns. Many men notice small but meaningful shifts, a quicker engorgement, richer sensation, or less soreness afterward. Edward, in his late 60s, told me that after 3 weeks of consistent omega-3 intake and attention to lubrication, he stopped waking up with lingering genital tenderness that had bothered him for months. That's the kind of improvement worth tracking. Safety reminders you must keep in mind. If you have known cardiovascular disease, talk to your cardiologist before using concentrated nitrate sources close to sexual activity. If you take prescription nitrates, that includes drugs for angina, avoid using high-dose nitrate supplements or attempting strategies without medical approval. Also, if you take medications for erectile dysfunction or blood pressure medications, coordinate with your physician before making changes that could interact. Never stop prescribed medication on your own. There are specific warning signs that require urgent medical attention. Any chest pain, shortness of breath, fainting or near fainting, or sudden severe headache during or after sexual activity. If you experience bleeding from the genitals, persistent numbness, a painful erection lasting more than 4 hours, or a new, severe pain in the groin or genital area, seek evaluation promptly. These are not normal and need medical assessment. Let's talk briefly about technique safety without getting explicit. The principles are simple and practical. Be gentle, use adequate lubrication, monitor pressure and friction, and listen to your body. If you feel a creeping numbness, burning, or a loss of sensation that doesn't resolve quickly, stop. Give tissues time to recover. Repetitive aggressive motions over years can contribute to chronic desensitization or injury. You don't need to explain this to anyone, you just need to act kindly toward your body. A few more practical tips that I give to patients in clinic. Temperature matters. Warmth increases blood flow. Warm bath or shower beforehand can make tissues more receptive and reduce the need for force. Posture and comfort. Choose a position where you can relax rather than tense your abdomen and pelvic floor. Tension compresses blood vessels and reduces sensation. Breath and pace. Slow, deep breaths support parasympathetic activation, the rest and repair mode that helps circulation. Quick, shallow breathing keeps you in fight or flight and can limit response. Avoid alcohol or sedating substances aimed to loosen up. While a glass of wine may relax you, excessive alcohol can blunt sensation and impair blood flow. If you're using over-the-counter supplements, discuss them with your provider. Some people assume natural equals safe, but supplements can have interactions and side effects. Now, let me emphasize something very important. Nutrition and self-care are supportive strategies, not replacements for medical evaluation when needed. If you have risk factors for cardiovascular disease, high blood pressure, diabetes, prior heart attack, or strokes, those conditions affect circulation and should be addressed alongside these lifestyle steps. Also, if you're on testosterone therapy or other hormonal treatments, don't make changes to those regimens without your prescribing doctor's guidance. So how should you measure progress? Keep it simple. A 30-day diary with 3 items per day is plenty. Morning erection quality, yes, no, or a 1 to 10 scale, energy level, 1 to 10, and any concerning symptoms, pain, bleeding, dizziness. After 2 to 4 weeks, you'll start to see patterns. Did mornings improve? Did sessions feel less effortful? Did you have less soreness afterward? Those small wins are meaningful. Throughout all of this, there's an emotional piece I want to address. Shame and silence around these issues are enormous obstacles. Men tell me they feel isolated, reluctant to bring these topics to a doctor, or worried they'll be dismissed as getting old. That response is wrong-headed. Talking about these concerns is a medically valid step. You deserve clear, practical guidance. You also deserve to be safe. If you're nervous about consulting a provider, bring your notes. Your 30-day diary makes a powerful conversation starter. Before I close, a quick summary of the 3 mistakes you must avoid. 1. Ignoring circulation, neglecting nitrate-supporting foods, and letting inflammation blunt blood flow. 2. Neglecting the mineral and hormonal building blocks, skipping zinc and magnesium support and expecting pills to fix everything. And 3. Forgetting nerve health and safety, low omega-3 intake, rough technique, and ignoring pain or numbness. Fixes include modest nutritional strategies, beet, watermelon timing, dark chocolate, oysters, pumpkin seeds, walnuts, flax, and fish, safe lubrication and gentle technique, and a simple stepwise 30-day plan to observe what works for you. One more time, do not attempt concentrated nitrate strategies if you are taking prescribed nitrates or have recent unstable cardiac disease without prior medical clearance. If you experience chest pain, fainting, sudden severe headache, bleeding, or an erection that won't go down after several hours, seek immediate medical care. This video is educational and intended to help you make safer choices. It does not replace individualized medical advice. You're not broken. You're not alone. Small changes, better nutrition, hydration, lubrication, and a gentler approach can make your self-care safer and often more satisfying. If you found this helpful, subscribe for more evidence-based sexual health information and share this with another man who needs to hear it. And don't forget to type your city and age or a quick 1 in the comments so I know you're here. Thanks for trusting me with this conversation. Take care of your body and reach out to your healthcare team if anything unusual comes up.